It's almost done.
So, Andy, am I pregnant?
Hi, I am Leftlateral in Texas. I am an X-ray tech working on weekend nights. Today I will talk about non-emergency patients who want to visit the ER. Have you been experiencing back, hip, knee, and shoulder pain for a long time? Since these are chronic pains, you can only go to the emergency room to get pain relievers. Many patients with chronic pains visit the ER for just getting pain medicine only. If you tell the ER doctor where the pain is, the doctor will order an X-ray examination. There is a rule that pain relievers and other medicines cannot be prescribed without an examination. However, the rules change when urgent and the patient's life is at stake. I will talk about a few patients who came to our ER. For some reason, this woman came in when I was on duty, complaining of back pain. The doctor ordered an X-ray of her lower back spine from her neck. After repeatedly complaining that she could not lie flat on her examination table, she completed her examination with her family's help. Looking at her X-rays, she has severe scoliosis and arthritis that is age-appropriate. In such a case, the doctor will prescribe painkillers and send you out of the hospital. And the following weekend, the patient came again. Perhaps she complained of the same symptoms to the ER doctor. The doctor again ordered an X-ray of her lower back from her neck. This time, the patient knows what to do because she and I know each other. However, her exam never gets any easier for both of us. Somehow we managed to finish it, and the patient went home. And next weekend, this patient came back for the third time. She has been complaining of pain for a long time. The pain has not been alleviated at all. This is my guess, but if you have that much scoliosis, it will affect your lungs, heart, and other organs. Arthritis will always hurt. For older women who are in pain during examinations, I told her, you come to the ER and tell the doctor where it hurts. It is a routine for the doctor to order X-ray. Did she realize that no matter how many times she came to the ER, the doctor would just give her a prescription for painkillers, and she wouldn't treat anything? Halfway through this third X-ray, she realized the patient could not be cured in the ER, so she declined the exam. I haven't seen her since. A little sad but happy. Older spine pain is a natural part of aging, and no one can escape it. Oral pain relievers have side effects such as stomach pain and constipation, so I don't think taking them every day is a good idea. So what about surgery? A growing young person can endure the post-surgery pain, the side effects of drugs, and the pain of physical therapy. When an older person undergoes surgery, it will be necessary to thoroughly examine whether the condition of the bones, heart, blood pressure, and kidneys can withstand the operation. Sometimes, older people cannot tolerate surgeries. This is my guess, but acupuncture, massage, and chiropractic care are safer if the body can endure it for such an older woman. In the ultrasound department, Lisa, a sonographer, told me, a 17-year-old girl was diagnosed with gallstones on her ultrasound. She returned the next week and had the same test again, Lisa says.
If she finds gallstones, she must have gallbladder removal surgery. To do that, you have to go to a specialist surgeon's clinic and get an appointment. For an ER patient to go straight to the operating room, Such myocardial infarction is a patient fighting for life-saving.
She doesn't think this girl can call her specialist unless someone helps her. Andy, a male sonographer, was complaining about something unusual. It was my first time hearing it too. When a male sonographer examines a male patient, the patient says a joke, "Am I pregnant?" The stereotype that ultrasound examinations are for pregnant women seems to spread among men. However, ultrasound is also used to examine male reproductive organs. This man came to the radiology department, so I performed a routine shoulder X-ray. Of course, there is no abnormality in the bone. When I asked how long the pain was going on, he has been in pain for a long time and has been to this ER many times. I commented that he would need an MRI if it hurt that long. This is because X-rays are tests to see the bones and metals of the foreign body, so damage to muscles, ligaments, and tendons cannot be seen. This guy probably has a rotator cuff tear. The reason is that this is the most common injury. Then the man said, he always came because he thought he would know something today. At the ER, you see a different doctor every time you come. You are doctor's first patient as well. If you are a first-time patient, it is natural to order an X-ray if your shoulder is painful. I haven't seen him since, but I hope he has met the right doctor. Many mild COVID patients came to the ER every day during the pandemic. Patients have different patterns. The patient to come to our ER with cold symptoms for the first time was tested for COVID. The result was positive, but if it was mild, they were sent home. However, many positive but mild patients came back in almost daily. This is due to difficulty breathing and chest pain. Also, patients who tested positive at a nearby drugstore, another clinic, or ER. For some reason, they came to my ER. Even though it was mild, they didn't isolate themselves at home and insisted on returning daily. They wanted to be admitted because it was too painful. Of course, a chest X-ray is ordered every time they come back. That's the routine. It is best for patients with mild symptoms of COVID to rest at home, but they seem to want to rest at the hospital. This may be because they live alone, have no family to take care of them, or even if they have family, they are too noisy to rest. Emergency rooms in the United States can be used by anyone anytime, even if it is not an emergency. Nobody is supposed to be turned down. Now let me introduce you to some unique patients. A patient got dumped by his girlfriend, and he was in shock. A young woman who her mother-in-law bullied. Some female patients came because their sons or husbands died. There was also a sick, elderly man who came to the ER because his wife had been hospitalized due to the coronavirus, and there was no one to give him food or medicine. As for the elderly, some patients abruptly ask me, "Are you Chinese?" It's rude to ask people about their nationality like this, but many elderly people don't know this etiquette. It is best to answer like a quiz in such a case.
Are you Chinese?
Almost. Try again.
Korean?
Getting closer.
Vietnamese?
Wrong way. What is your car?
Lexus.
What is the country of origin of Lexus? Thank you for your viewing. Let me know what you think about this video in the comments. If you like this video, please give me a thumbs up. And subscribe to the channel.
I wanna stay with you. With you. I love the way that you love me today. Let's run.